Hi, I'm Shayma Kazmi. I'm a thoracic medical oncologist. I work for Penn Medicine Cancer Center in Cherry Hill, New Jersey. There are several global challenges into implementing precision medicine for all malignancies. Some of the ones that I've highlighted during my ESMO 2022 presentation are ones that revolve around evolution of agnostic tumor treatments. And so a lot of our cancer treatments to date have been histologic specific. Clinical trials, randomized control trials. We're shifting gears a little bit to basket trials for smaller genome-specific clinical trials that are really not histologic specific. And so there have been lots of approvals recently of drugs that target certain aberrations in the genome of the malignancy, such as pembrolizumab, for instance, for TMB high, and TRK for TRK-driven malignancies, and BRAF V600-driven malignancies having its own set of treatment options. Some of the other challenges I discussed is this idea of testing for next-gen sequencing and looking for a genomic driver in end-stage cancer patients in hopes of providing additional benefits with time of life, as well as considering if these are significantly cost-saving. And the challenges there are many, including it's hard to discern that benefit, and what the European trial MedAction found is that if the cost of next-gen sequencing and the drugs associated with them were decreased, these may still be beneficial even towards the end of life. The other very important topic I discussed is this idea of molecular tumor boards, whether they be virtual or in person, across institutions within the United States and of course in Europe and other countries, to be able to better figure out the best modalities of treatment for some of these patients who may or may not have these genomically driven cancers. And so the important discussions and pain points to that is where should we have these, who should be on these molecular tumor boards, and do we have the ability to have all of these people in these MTBs. And we do know that MTB-driven cancer treatments, even at the larger clinical centers, do improve patients' PFS and overall survival. And so there's data to support its use, but widespread adaptation of molecular tumor boards is, of course, difficult. It's a logistical challenge, but we know that interpreting some of these test results, as well as identifying what may be bystander genomic aberrations in the right context and what may actually be driving the tumor growth, is sometimes difficult to tease out. So with that, thank you so much for attending ESMO 22.